Hello, my name is Ravin Patel. I'm a second-year family medicine resident, and I'm presenting a case entitled Giant Cell Tumor with Aneurysmal Bone Cyst. So we present a 34-year-old male with no past medical history who presented to radiology after trauma to the left knee. He fell a few months prior to the presentation, had a traumatic fall, was still bothering him, so he decided to come in for some x-rays, which were ordered by his family physician. When he got his initial x-rays, it showed a 8 by 6 by 5 centimeter cystic lesion involving the proximal tibial metaphysis and epiphysis. Right then and there, radiology had a high suspicion for germ cell tumor or giant cell tumor, so an MRI was ordered with and without contrast, which showcased a 6.7 by 6.7 by 6.3 expansile enhancing lesion at the lateral tibial plateau. The lesion was well circumcised and extended through the lateral tibial cortex into the soft tissue, and the findings were consistent of a giant cell tumor with secondary aneurysmal bone cyst components. The patient was then transferred over to Cooper, where he had orthopedic surgery to resect the tumor. So, in general, giant cell tumors or osteoclastomas are benign tumors of the bone, typically located at the metaphyseal zone of the long bones, and giant cell tumors are commonly diagnosed in women, actually, of average age of 20 to 40. Although they're benign, these tumors can metastasize to the lung, adding morbidity to the disease in 25% of patients, but frequently not mortality. So this patient did undergo CT scans of the chest, which were often negative. So aneurysmal bone cysts, on the other hand, are more vascular type tumor that can complicate a diagnosis of the primary tumor a few percent of the time. Due to its ability to invade vascular channels, it is thought that aneurysmal bone cysts further exacerbate primary tumors such as giant cell tumor. So X-ray and MRI are the standard of care for diagnosing this, and management in non-regressed tumors can include bone grafting, excision, radiation therapy, intracystic injections, and embolization.